Now we are moving on our Pemphigus vulgaris. Pemphigus vulgaris. Regarding Pemphigus vulgaris, like Pemphigus means watery blister, blister, and when you look the causes of this cause, when you look there is IgG mediated, it is IgG mediated attack, and it's attack to the IgG mediated attack to the desmosomes, and mainly in the desmoglein, and it's look like in between the in between the keratinocyte, in between keratinocytes, and when you look like it is a type 2 hypersensitivity, type 2 hypersensitivity, and when you look like presentation of the clinical presentation of this disease, so there is like presentation, there is like skin and oral mucosa bullae, like skin, and there is oral mucosa bullae, and when you look like there is a acantholysis, and also there is tombstone, then there is Nikolsky sign, and when regarding this acantholysis, like it is a separation of the stratum spinosum and the keratinocytes, like it is connected, this layer is connected by the desmosome, so there is a result of the separation occur, and the result is like there is a result of formation of like suprabasal bullae. And regarding the tombstone cells, there is a tombstone cells, so the basal cells are still attached to the desmos and appear as a tombstone. And regarding this Nikolsky sign, like bullae are thin and walled and they rupture easily, making the shallow erosion and with dry crust. So these are the our clinical presentation, and also there is like potentially fatal. It is potentially fatal in case sometimes potentially fatal. When you look at the immunofluorescence of this so there is like fishnet immunofluorescence pattern seen, like IgG surrounding the keratinocyte. So there is like fishnet type appearance, like fishnet like appearance, like fishnet like appearance seen. Regarding that, there is a IgG surrounding keratinocyte, So moving on the another like bullous pemphigoids. So bullous pemphigoids is similar to the pemphigus, and when we look at the causes, so now moving on the bullous pemphigoids. And this is regarding the similar to the pemphigus. So when we look at the causes of this disease, so there is it is also like IgG mediated attack to hemidesmosome. Here IgG mediated, and there is attack to the hemidesmosomes, and in between between the basal cell, in between the between basal cell and there is a basement membrane. So when you look at the clinical presentation, so there is a blister in the skin, blisters on skin. Blisters on the skin. There is usually in the elderly, and like there is contact to the Pemphigus vulgaris, like, but bullae does not, this bullae does not rupture easily, doesn't rupture easily. So when we look at, like, there is a mucosa in this disease, there is a oral mucosa is spared, oral mucosa spared. And regarding the clinically, this is milder than the Pemphigus vulgaris. It is milder than Pemphigus vulgaris. Pemphigus vulgaris. So when we look at the, like, immunofluorescence, so there is a linear pattern seen in immunofluorescence. There is like linear pattern seen, linear pattern. Linear pattern seen. So now we are moving on the dermatitis herpetiformis. What that is? This is dermatitis, dermatitis herpetiformis, herpetiformis. So regarding dermatitis herpetiformis, when you look, like, there is like causes is like IgA deposition at the tip of the, like, dermal papillae, deposition at tip of dermal papillae. When you look at the, like, presentation of this disease, in the presentation there is a grouped pruritic papules scenes. In the presentation there is like grouped pruritic papule vesicles and bullae are seen. When you look at the association, like, there is a strong association with the celiac disease, associated with celiac disease. This is celiac disease, like GI tract disease. So when you look at the treatment of this disease, there is in the treatment there is treatment, like, we give the gluten-free diets. Gluten-free diet. Like, this gluten exacerbate the IgA, and that leads to, like, this disease. Now we are moving on the other disease, like erythema multiforme. In the erythema multiforme, there is like a presentation. So when you look at the presentation, there is hypersensitivity reaction with the targetoid rashes. Like, there is a target with the multiple rings and a bullae. So when you look at the presentation, clinical presentation of this disease, so there is a hypersensitivity reaction with, there is like targetoid rash. There is this is like target with the multiple ring, and like there is, and also bullae. And when you look at the target rashes, is due to the central epidermal necrosis and surrounding the erythema. So this target rashes is due to the, like, central epidermal necrosis, and like when you look at the surrounded by erythema. When moving on the causes, so there is this disease is caused by the, like, SSP and also mycoplasma, drugs, penicillin and sulfonamides, and autoimmune SLE and also malignancy. So So these are the causes. So now moving on the Stevens-Johnson syndrome. Stevens Johnson syndrome, SJS. So regarding this, like in this there is edema multiform bullae necrosis and clogging the skin and with the fever and also mucous membrane involvement. So when you look like there is a erythema multiform bullae necrosis and the clogging of the skin, with fever and mucous membrane involvement. So when we like typically it's a two mucous membrane involvement in the eye and lip. Mainly there is a typically two mucous membrane involved like lips and eyes. And also like the mostly associated with the adverse drug reaction, ADR of drugs. So another is the toxic epidermal necrolysis. Another condition is a toxic epidermal necrolysis. Regarding this is like presentation. When look like in this there is also like presentation of the more than 20% of the Stevens-Johnson syndrome, like the appearance more than 30%. And when we look at the body surface diffuse logly and the top of the skin resembles the large bone, like look like the large bone of the skin, large bone like skin. And when we look like there is a separation of the cell is epidermal junction. There is like separation of cell at the dermal and epidermal junction. Like there is a scaled. When you look like there is a between this separation there is like the scaled skin syndrome, and that separates it stratum granulosum and when moving the causes of this, so in the cause is mostly due to the adverse reaction of this disease due to ADR of drugs. Now we are moving on the like these are the pathology of the skin. So now we are moving on. In the next video we discuss regarding the epithelial tumors or tumor of the skin. Then we also discuss regarding the type of the tumors. Then we also discuss the pigmentation and melanocytes and disorder related to the pigmentation and melanocyte in the coming videos. And also we have discussed like melanoma, this type of diseases. So and also there is also infectious disease. So already I have discussed in the like microbiology portion. There is like fungal infection or other infection, but we also connect with the like pathology.